Good morning. This Saturday, 9:30 a.m. USA Eastern Time. This is a regular Saturday morning class. We're doing a series. A series is called Yoga Therapy, the Art of Transformation. So, what do we transform? We are all called in Sanskrit called Rogi. Rogi means a patient. From a patient we transform into called Nirogi. Nirogi basically is a healthy, disease-free. Then finally we enter into Yogi. Yogi is a person who can be described as a human being who is in balance with the environment or the nature. Sanskrit called Jatha Pindo Tatha Brahmando. That means a balance between our microcosm and a macrocosm. And the practice will be based on called intuitive practice. So last Saturday we did a practice for Rogi, which was primarily in the sitting in a chair. Today we'll be doing it for called Nirogi, the healthy person. And many of our viewer who is participating with us are also sitting in a chair. So all the asana practice we do will be modified according to sitting in a chair also, and I will guide you. But remember, the therapy is your pranayama. Pranayama is our active ingredient. And if you look at from Western perspective, if yoga therapy is a pill, the asana is a pill, the active ingredient inside the pill is your pranayama, and the mechanism of action is a meditation. That's what we say all the time, meditation is medication. Now remember one thing, that yoga therapy practice is not a reductionist practice. It is not like our Western medicine, that we have a therapy for a condition and a disease, and it is a holistic. That means it is a combination of a relaxation response, activation of parasympathetic tone, and a set of pranayamas, guided pranayamas, and a guided meditation. So metaphorically we can say a reductionist approach is like playing a tennis. You play one against another. I have a headache, I take Tylenol. I have a pneumonia, I take antibiotics. But a yoga therapy is like a football team. You have all the players will be all together and you decide what to do. Now, take the concept. I have a lot of yoga teachers, yoga therapy teachers who are also watching. And with this online now, so a lot of really maintains their health. What is the health in definition of yoga? A health is defined as a strong digestion, easy elimination, and a good night's sleep. Basically, we call it dreamless sleep. So let me take you a couple of minutes to explain to you what a health means in yoga therapy perspective, and then we'll start our practice. Like our Western medicine, we're a Western trained physician. We know all about disease. Where is the problem with the enzymes? What is the receptor problems? We know everything about disease. But when you ask from Western medical perspective what is a health, they will say health is the absence of disease. I go to see a doctor, he does my blood work, he does all my imaging studies, do my mammogram, my colonoscopy, my stress test, everything is normal, I'm healthy. But yoga therapy is totally opposite. Yoga therapy is, the disease is the absence of a vibrant health. You have a vibrant health. You have a strong digestion, you have a proper elimination, and you have a good night's sleep. Strong digestion comes from a digestive fire. This is called the Agni, JATHAR Agni. So we'll do the asanas which ignites our JATHAR Agni. In Sanskrit called it Agni Deepana. When the JATHAR Agni is ignited, then you get a proper response to your parasympathetic activation. And parasympathetic is the nerve supply to your whole gastrointestinal tract. So the food gets properly digested. In yoga therapy, food is not a calorie. Food is not that you can burn by doing exercise. When exercise is a sympathetic, you're doing totally opposite. The food turns into toxin. It's called ama. But for a healthy person, food converts into called saptadhatu, 7 tissues. Rashadhatu, plasma, raktadhatu, red blood cell. Mamsadhatu is your muscle cell. Medodhatu, fat tissue. Asthidhatu is your bones and joints. Majjadhatu is your nervous system. Shukradhatu is your reproductive tissue. Then it converts into a product called ojas. Ojas is your body's immunity. Ojas is what is defined as a health. And the ojas is the one you need for today to fight against a coronavirus, the COVID-19, when you don't have any treatment, when you don't have any vaccination. So we'll do a practice to ignite our Agni, JATHAR Agni. Then you do a practice about 5 or 6 asanas, which are called a Laghu Shankha Prakshalan. Big Sanskrit name. Laghu means your less. Shankha is a metaphor of your intestine. Prakshalan is a cleansing. It's a yogic kriya. You generally in a Purna Shankha Prakshalan, that means when you do the full yogic cleansing, you drink 2 glasses of little saline water, you put a little salt in the 2 glasses and do the 5 asanas. May not have any elimination, then you drink another 2 glasses, do another again the 5 asanas. Keep on doing it. Finally, within half an hour to 45 minutes, first you will have a nice bowel movement, then essentially you see all the water will come out. We do not do the drinking water, we'll do it here, the 5 asanas. Then we'll do called a good dreamless sleep. And dreamless sleep, like we said, we sleep like a baby. If you sleep like a baby, you will see when the baby is sleeping, they get a abdominal breathing. When the baby is relaxed, when they're breathing in, stomach wall will rise high up, breathing out, stomach will go in. Baby will sleep with asana, putting feet together. It's called your Supta Baddha Konasana. Baddha Konasana, babies always put the feet together and sleep. And we'll show you how to do the sleeping. Initially we sleep on the right side because on the right side left nostril opens up, and there's a reason for it, and we'll explain a little bit when you do how to do a dreamless sleep. Just to explain a little bit for that sleep, because we have a lot of healthcare providers, a lot of yoga therapy teachers are watching it. Sleep has a 2 component. One is called REM sleep, called rapid eye movement sleep, another called non-REM sleep, non-rapid eye movement sleep. A rapid eye movement sleep is still, I'm awake, alert, I'm very conscious, my mind doesn't quiet down. So that sleep is not being good for my body and mind. Non-REM sleep, which is mostly over it cycles between REM and non-REM sleep. It is a 4 stages, stage 1, stage 2, stage 3, stage 4. Stage 3 and stage 4, we get all the healing from our sleep. But interestingly, stage 1 and stage 2 is almost 50% of the sleep. So what happens when you're doing a daily practice of yoga, you are always in a meditative state, that you're always in a stage 1 and stage 2 of the non-REM sleep. So when you're practicing yoga, you really don't need much sleep. And also remember, sleep is not a number. I'm sleeping 6 hours, I'm getting 8 hours. No, it's a quality of sleep, it's not the quantity of sleep. Sleep has a latency. What is the latency? When you fall asleep, you don't go to sleep right away. It takes about 10 minutes to 30 minutes. If you fall asleep less than 30 minutes, what happens? You develop called the sleep deprivation. That means you did not have enough sleep the night before. If you cannot sleep after 30 minutes, you develop an insomnia. And what is killing us today is a sleep apnea. And we'll talk about all this. We do all the practice for sleep apnea, the pranayama, like Ujjayi Pranayama is for snoring and sleep apnea. So very important. Sleep is one of the most important component of a daily practice of yoga. So if you're sitting down in the ground, it's good. Always the component of your practice. The first component of the practice is any asana is called sthiram sukham asanam. Sthiram is a stillness. When I am in a posture, I'm not having this little bit of a called fasciculation. My muscle is contracting, taking me to the posture asanas, but I'm staying here long enough, slowly and slowly it relaxes, the fasciculation is gone, and I get a profound level of relaxation. In fact, it is so relaxed, it takes me to the level of meditation. Remember, meditation is yoga, and yoga is meditation. Ultimate outcome of yoga is a meditation, and meditation is the medication. At the level of meditation, our mind secretes all the medications you can think about. You know, it secretes your ACE inhibitor, it secretes your beta blockers, aspirin, statin, you can name it, and I can show it to you exactly what is the mechanism and how it does. So grounding pose is very important. Next is your spine straight. So I have a chair behind me. So if you sit in a chair, what you will do, you will keep your spine straight. Once you keep your spine straight, what happens, all the paraspinal muscles, the muscles which keeps me straight, is very hard, tight, and I can feel a two piece of brick sitting here. But once I keep my spine straight, called Merudanda Achal, slowly and slowly I can feel a two piece of like a pillow sitting here. And then my normal posture. I'm eating, I keep my spine straight. Driving my car, I keep my spine straight. So I have shown it to you before, but let me show it to you again one more time. Let's see if you can look at this chair, and we'll be doing something in a sitting here also. So let me push it down here for the time being. So in a chair, what we'll do, when you sit in the front, you'll keep your spine straight. If you look from a profile, I'll have exactly a 90-degree posture. Or if you go all the way to the back, you'll be sitting down. You're not going to support your in the back. You'll be in a perfect spine straight. Okay? So the asanas which are going to increase my JATHAR Agni, my digestive fire. Digestion, the food will be converting into 7 tissues, and that is a sign of my health. So we'll do an asana called a Mundukasana, called a frog pose. We'll do first sit down in a called a Vajrasana. We'll be sitting down in a very grounding poses. Those are very important asanas, and do in stages. And I'll guide you if you're sitting in a chair. So let's sit down in the ground. Initially we'll do first 3 asanas. These are also in stages you do it, and people always ask me, I cannot do it, what should I do? What is the word we use? In stages, impossible become possible. So what are the practice? First I put my feet underneath my knees, and I cross my feet, my spine is straight. Then I use called a Hasta Mudra, the hand gesture. This is called your Hana Mudra, the Magana Mudra. I have a whole, remember all my practices are all being recorded in the Facebook and also being uploaded in my YouTube channel. You'll see I have a whole session on the mudras. Mudras are the neurophysical connector for taking the prana, the subtle energy which is carried by your breath to the organ of healing. So when you put there, close your eyes and just pay attention to your breath. Just when you relax, you breathe out longer than breathing in. Lung is like a balloon. It has a 4.5 liter capacity called vital capacity. That's the amount of air we can exchange. We only breathe 0.5 liter. So when you are doing a relaxation response in your body and mind, you will see what is happening to me. You get a saliva in your mouth. Your mouth becomes wet. Because why? Because the salivary gland is supplied by parasympathetic nerve. When you are afraid, when you have a stress, you get a dry mouth. So you breathe out first. Take a deep breath in. Try to breathe out longer than breathing in, 1.5 or 2 times. Sitting in a chair, please do it sitting in a chair. We have shown you this practice before. We keep progressing, but you do only when up to your no effort. If the effort, you do count of 4 in, count of 8 out, count of 8 in, count of 16 out. We can easily do count of 10 in and 20 out because we've been practicing. So for example, when I'm very calm, relaxed, I can breathe out first. I can breathe in almost count of 10. I can breathe out almost count of 20. When you feel this level of comfort and relaxed, when you have saliva in your mouth, then try this next posture that is called changing your feet. When you change your feet, you'll see you are comfortable, more comfortable in one side. Why? Because we're lateralized. I'm right-handed, right-footed. One half of my brain is working mode. But if you sit down a little bit, you will see you at the level of comfort will come. You will be a Nirogi, the healthy person, when you cross your feet, opposite side, you still feel very comfortable in both sides. That means both half of your brain is working. You're not only right brain or not only left brain, you're both. It is called your synchronization, harmonic synchronization. So a lot of work has been done, a lot of studies have been done. The two sides of the brain work independently and need to work both of them. Next one is a grounding pose, is that you sit down, put your heel all the way to the back, take your feet on the top, your knee drops down very easily. And longer you sit down. So what you look for, no pain. So if it is causing pain, you just back off. But stay here, close your eyes, do the breathing out longer than breathing in with your eyes closed, and slowly this thing is going to happen. Exhalation is your parasympathetic, inhalation is your sympathetic. You should have essentially normal breathing, effortless ease. You'll be able to talk, you'll be able to sing, a smile in your face. We have a beautiful weather today here in Norfolk. I opened up both the big doors here, sliding doors, and I get almost a fresh air. I'm really like even in the house, but I'm doing a practice even in a mother nature outside. So next one will be in stages. When you do, remember, no pain and effortless breathing. Put your feet in the top. And again, if you feel uncomfortable, a little pain, you back off. Find some place where you have a little less pain, because if you say it's hurting me, I'm not going to do it, It's fine. Go home, take some pill, and start digging your grave. There will be no sign of any health. This is your sign of health. This is your flexibility. Flexibility of the spine or flexibility of the body is health. Rigidity is your disease. Rigidity is death. In Western medicine we say when somebody dies, what happened? You call it rigor mortis. Rigidity is not like EKG. EKG has a very nice flexible spikes. When it became a flat line, become rigid, we're all dead. See how comfortable I am? So I'm showing it to you how easy it is to go in stages and get into a profound relaxation practice. People are watching me, you know what I'm driving it to you. I'm driving it to you that I'm going to go into your Padmasana, Lotus Pose. I could get into the Lotus Pose very easily, but I'm showing you the steps. Sukhasana, the crossing on both sides. Siddhasana, crossing both sides. Ardha Padmasana, crossing both sides. And then when you are comfortable, you go and put other foot high up, sit down. You sit down in a Lotus Pose. Lotus Pose is powerful, relaxing. If you're sitting in a chair, you also sit down in a chair, cross your leg, and you can always modify, sitting all these asanas sitting in a chair. When you are relaxed in a grounding pose, what happens to you? You develop a profound level of a relaxation, parasympathetic activation, and lightness your body and mind. And you check it with a Tulasana. Very simply, put your hand on the side, push it down, your whole body goes high up. Body goes high up, stays high up, can stay here 10 seconds, 20 seconds, 30 seconds, 1 minute, 2 minutes, even 5 minutes. You don't feel the weight in your body. This is activation of your parasympathetic tone, activation of your digestive fire. Very important. Then you do all these small relaxing asana, relaxation of your hand, raise shoulder, neck, Brahma Mudra, which I have already shown it to you. You do Paschim Namaskar with a hand. But let's go beyond that today. We'll go ahead and show you the asanas to activate your Agni, JATHAR Agni. People always ask me, how do you describe Agni? Agni in Western term is a proper perfusion, proper innervation, and proper function of an organ. A powerful asana for your igniting your JATHAR Agni is your Vajrasana. You able to sit down, you put your feet here, sit down. Initially, if you have any problem, you can put a little bit of a roll under your ankle. Remember, I always like little folded towels, because what happens, you will develop slowly and slowly, we call it habit forming. It's called neuroplasticity. And neuroplasticity sets in, you will be able to take them out. Sit supporting my spine, supporting my head. Sanskrit is called a Merudand. Merudand. Shirdhara, very powerful word. Merudand. If you look at English translation, you will be surprised how beautifully we're described about the spine. This is one asana we do after meal. We have seen our grandparents, our ancestors, even our parents, after a full meal, they will sit down in a Vajrasana, thunderbolt. This is also asana being practiced, a lot of spiritual practice, a lot of faith. A lot of faith will do a prayer on this asana. This is called a Vajrasana. So remember, we do all the asana practice, pranayama practice, in an empty stomach in the morning, or about 3 or 4 hours after a big meal. And this is the asana we can do in a full stomach. In fact, it helps, especially after dinner at night. Sit down, have a proper digestion before you go to bed. So the next one is called your Mandukasana, very powerful igniter of your Agni. It's called a frog pose. Take your hand, remember the relaxing asana in the hand is Adhi Mudra or Balabushka Mudra. That's the way baby closes the fist. Put your thumb inside and close. Initially it may be here, here, but all come here. Put your both the knuckles together and slowly bring it to the level of belly button. And remember, this is a non-competitive practice. You are not competing with anybody. Listen to your body's signal. Pain and effortless breathing. Your breathing has any effort, you stop. So here, first you breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in a little bit like a Uddiyani Bandh and keep on coming down. And listen to your body's signal. What is your body's signal? Pain. There is no pain. If you feel any pain, back off. But stay here. If you don't have any pain, you keep coming down, then listen to your breath. What is your breath? Breathing out longer than breathing in. You can talk, you can even sing, you can come all the way down. If you have any issue at all with your breathing or pain or any effort, you can go all the way down. Then you can come back. Many a time your hip goes high up. Initially if it goes high up like this, it's okay. Remember, it is not the alignment, it will come to you. So I can always sit it down, I'm showing it to you. You can always do it sitting in a chair. You can always will come down. So if you're sitting in a chair, put your hand on your abdomen, sitting in a chair, slowly bend down. Mandukasana ignites my JATHAR Agni. Concept, as a yoga therapy teacher, you will understand. Next one is a profound relaxation. Remember, parasympathetic activation. Shashanka Asana, moon or a rabbit. What happened in a rabbit? Rabbit is running very fast. Suddenly, rabbit comes down. So let me show you. I can show the side or the front is okay. All of you are know the same thing. Hands going to go high up. It will come all the way down in the ground. And then your hand comes down and go to the back a little bit. So you can see that. Hands will come all the way to the ground. Elbow comes down. Slowly your head comes down. Your head is on the ground. You're breathing in and out, breathing out longer than you're breathing in. Shashanka Asana. Wonderful asana to ignite your Agni. Since I'm not going to do asanas on the chair, but I'm going to guide all of you. Let me push the chair a little bit on this side. So I can go a little bit on the back and show you all the asanas I'm doing. So what are the asanas we have done by now? We have done the grounding asanas, which are, Sukhasana, Siddhasana and a Padmasana. Then you do your Vajrasana, Thunderbolt. Then you did a Mandukasana, the frog pose. And is your Shashanka Asana. Next, sitting down, a very wonderful asana to ignite your Agni is your Bakrasana, spinal twist. In a Bakrasana, what you do, you put your feet in front. So if you're in a chair, you can do it. Put your feet in the front in a chair. Then slowly you take your right foot, you bring it close to your left thigh. Very nice, and hugging, loving, is all smiling. It's a beautiful practice. Slowly, you push your right knee on the left side. Bring your left arm outside your right knee. Right hand goes to the back. Left hand comes initially like this. Touches your knee. Take a deep breath in. Slowly turn your body towards your right side. and able to stay in the posture without any effort in your breath. So, if you are practicing with me, you will notice the moment you push little bit more, your breath catches. So, what you need to do, effortless breathing, and 5 to 10 breath is good enough for your a good practice. Very, very important concept. Staying in the pose is yoga. Staying little longer with the effortless breathing and no pain is yoga therapy. Getting in and out of a pose or in and out creating a muscle contraction is an exercise. Exercise is sympathetic. Opposite side, left foot comes close to your right thigh. People always ask me, how do you do all these practices at your, no, my age? I don't have any age, you know. I'm young. I'm young in my body and mind. So don't talk about my calendar age. Huh? So again, so push. Left knee is going down. Right arm goes out of here. Huh? When it goes out of here, so it's very easy. Left hand goes to the back. Right, easily comes down. Touches your knee. You breathe in slowly. It's a very powerful asana to relax your spine, and also powerful asana to ignite your Agni, JATHAR Agni. So, if you're sitting in a chair, you'll be able to do it. Cross your leg and then turn your body, hold the side handle. A beautiful practice. Next one is your very powerful igniter of the Agni, is your Ardha Matsyendrayanasana. There is no English translation for this. These are the name of the rishis and yogis which came through, but yeah, many a time we call it a half Lord of the Fish pose. That doesn't mean anything. You know, the direct English translation has no meaning. So I always tell the people in the Western yoga practitioner, you always translate the essence of the asana, the bhav of this. Huh? So essence of the asana is more important than the name. When you sit down like that, this is also a preparatory for your Gomukhasana, cow face. We'll do it now. Cow face you'll see after Ardha Matsyendrayanasana. Because the cow face is, when you sit down, it looks like. This is such a comfortable, relaxing asana. What happens essentially, like if you're sitting down in a chair or sitting down even in a sofa, you'll see suddenly your feet will come up like this and you really don't know you'll be sitting like this. It happens so many times, even to me. You know, I'm in a big conference, I'm giving a talk, I'm wearing my suit and tie, I'm sitting in a chair, suddenly my feet goes high up, or I'm sitting in a lotus posture, Padmasana in a chair. Everybody looks at you, you know. But that is your normal, that is your normal neuroplasticity. So you bring your feet, your right foot close to your left knee. People say difficult asana. There is nothing called difficult asana. What is difficult? Difficult mind. I cannot do it. Who cannot do it? My mind cannot do it. My body as mind is not prepared. When some relaxation response, I can do it. Slowly, you can see, I'm pushing my right knee towards all to the left side. And left arm will come, it will come outside, and my right hand will go to the back. Left hand will be here, touches your knee, touches your ankle, touches the foot. Our body is like a rubber band now. So excellent igniter of your JATHAR Agni. Breathe out first, take a deep breath in, slowly turn your body towards the opposite side. Remember, always do the balancing poses. So I'm talking, I'm breathing, Even myself, if I go a little bit further, I can feel my breath is getting interrupted. I'm showing you, that's why I'm not doing the full practice. Full practice will be between your 5 to 10 effortless breathing. Okay, change your foot now. Yeah, I could have shown you the Gomukhasana, cow face at the same time, but it's nice, when I sit down here, I keep talking. When I keep talking, that means I want you to stay in the pose for a little longer and longer. Beautiful. I'm having all the natural noises. I live in a little downtown area, so all the natural noises are coming in, and I love it. This is really the yoga practice we need. So now opposite foot, left foot comes close to my right knee. See, I'm doing in stages slowly. Remember the word? In stages, impossible become possible. Wonderful practice. So slowly, you bring again, see, slowly and slowly, you push your knee, and when you relax, it will go all the way out, and the right arm will come outside your left knee, left hand will go to the back, you'll stay like here, touch knee first, then your ankle, then you'll come to your foot. Deep breath in, slowly turn your body and stay in the posture. You'll have a smile in your face, and whenever you are going to eat, you're going to have proper digestion of the food. In the West, we said, we are what we eat. Yoga said, no, we are what we digest. What we digest, that it becomes our body. Very, very important concept. People ask me, what do I need to eat? Intuitive eating, you know exactly what you need to eat. If your food becomes part of your body, you have a few signs. First, lightness in the body and mind. When you eat something, you feel heavy, the food is not become part of your body. Lightness in your body and mind. No smell in your excreta. We have 3 main excreta. We have a stool, urine, and a perspiration. Which a stool is the excreta of our solid food. Urine is a excreta of our water. Perspiration is an excreta of proper metabolism of our prana, the life force. When prana flows freely, we get a proper perspiration. If any of them smells, the food was not part of your body. No smell in your belch after 2-3 hours. Proper natural urges. Let me show you another powerful relaxation. Let me do other way. We'll be doing your Gomukhasana or a cow face, and also let me start showing you the Paschim Namaskar. Say Namaskar Mudra, we put a hand like this, and I'll show it to you how do it very easily and nicely through our back, called Paschim Namaskar. So let me sit down again in the same like a posture for the Gomukhasana. This time my right knee is in the top of my left knee. Right knee top of the left knee. Let me first do a Paschim Namaskar. In a Paschim Namaskar, what we do, take your hand here, and if it is here, it's good. Find it out, what is your level of comfort, and slowly if you can turn it around, it will be your Namaskar Mudra. Prayer pose to the back. And slowly you can go high up, and find a posture where you are comfortable with no pain, effortless breathing. You have your eyes closed. You are going to do the breathing breathing out longer than breathing in. Many a time in this posture, I also do my Brahma Mudra, the rotation, relaxation of my neck. Like I'll drop my head down, I'll breathe out first, take a deep breath in, and slowly rotate my neck. So what happens when I do this Brahma Mudra, when I do my relaxation of my neck, and with a few times you'll see my hand will go high up a little bit more. And that's the way your hand keeps on going high up when you create a relaxation response. I'm doing the opposite side. It's another wonderful response. This is a prayer pose to the back. These are all activation of your parasympathetic tone. Beautiful. Now, say your Gomukhasana, cow face. My right knee is in the top, my right hand goes high up. My left hand comes here. Many a time I need to really proper positioning my left hand. So what I do, I hold my left elbow, I slowly bring my hand in the middle, keep my hand in the middle, take my right hand, put it down, touch it, hook it, and literally I can handshake each other. Wow, what a relaxation. And think about this, a powerful therapeutic asana. My whole upper part of the body is relaxed. My fingers are relaxed, hand is relaxed, wrist is relaxed, elbows, my shoulder, my neck, my whole upper part of the body. In the lower part, my ankle is relaxed, knee, hips, back. It is an activation of your parasympathetic tone. If you cannot do it initially you'll be holding somebody else's hand. It's very interesting. You use a little bit of a strap, a little bit of a handkerchief, and slowly bring it close to it, and slowly bring it close. It's a wonderful practice. Always balance it. So I'm going to balance it now. You take now you're going to put my left knee on the top of my right knee. Before I had the right knee in the top of my left. Now the left knee in the top of my right knee. Left knee is in the top, my left hand goes high up. When the left hand goes high up, again my right hand comes here, and I can stabilize my right hand. Hold my right elbow, bring it up nice and very nice in the middle. My left hand is up, we touch it, hook it, and essentially I can handshake together. It's a wonderful practice. Now you will notice one thing when you're keeping doing it, your one side feels easier than the other side. Why? You lateralize. You always use your right hand and never use your left hand. So your brain doesn't allow you. This is not that I'm trying to do it. My brain is allowing me to do it. So I'm sitting, I'm talking, I'm breathing. This is the state of yoga therapy. No huffing, no puffing, nothing to do. In fact, people ask me all the time, how do I learn how to do the yoga therapy in a practice? I said, you always do it about half of your capacity. It's not like an exercise which is a sympathetic overdrive. Very, very important concept. We have a lot of other sitting down asanas you can do to ignite your Agni, but laying down, when you do the laying down asanas, there are 4 or 5 asanas which will also ignite your Agni. Let's do some asanas. You can do asanas, you're sitting down. You can do asanas, you're face down, face up. So let me show you another asanas. There are 5 asanas which also helps with proper elimination. Shankha Praksalan. The Shankha Praksalan, the one asana is called your Shankha asana, or called Udar Karshanasana. Udar means your stomach, Karshan is a massage. Then it's called your Tirjak Bhujanga asana, that you get into a cobra pose, and a cobra pose, you turn your body taking a look at the opposite side. It's called Oblique Cobra pose. We'll do that with a face down. And really your Bhujangasana, Cobra pose, your Locust, your Shalabhasana, Dhanurasana, bow pose, anything, all the back bends on the mat are also very effective. Okay. So sitting down, what is a profound relaxation, and especially in yoga practice, is called your malasana. You are able to sit down in a squatting pose. So look at what is happening in the squatting pose. I do it every morning. Wake up in the morning, I sit down squatting pose. I drink a glass of water. Water, I use it in a gulp. Because in a gulp, it starts doing my peristalsis. And then I have a gastrocolic reflex. When I have a gastrocolic reflex, I have a proper elimination in the morning. This is called your Udarkarshanasana. So hold your hand here and slowly put it down, right knee in front of your left foot. Push your left knee towards your right side. Take a deep breath in, slowly turn your body away from you. This is one of the asana for your Shankha Praksalan, proper elimination. Let's come back again, do the opposite side. Bring your left knee in front of your right foot. Right knee will be pushing slowly on the other side. A deep breath in, turn your body to the opposite side. And slowly come back. Udarkarshanasana. So there are 5 asanas. This is the first one. Next one will be the Tirjak Bhujangasana. Then we'll be doing a standing up, 2 asanas. It's called your Utthita Tadasana, upward mountain pose, oblique mountain pose, and then you do your Katichakrasana, west rotation pose. So laying down postures, let's do it first, and then we'll do the asanas for to go to sleep. So now, okay, first let's do a little standing up. So when you get up from here, it's a very nice way. When it's here, you don't do anything else. If you're sitting down here, let's get up sitting down without a support. That's a sign of your health. Very, very important yogic concept. So always balance to the balancing poses. I'm comfortable standing like this. Put your feet together. Bring a proper balance. Have your hands together. Clasp it. Slowly put it on the top. Breathe out first. Take a deep breath in and slowly see if you get your tippy toe and the hand goes high up. Upward mountain pose. One of the pose for your Shankha Praksalan. Breathe in, breathe in, and breathe out. We have done a lot of studies. Upper GI study, the X-ray, it shows it has a proper transit time, gastrointestinal tract. Oblique mountain pose, Tirjak Tadasana. Breathe out first, take a deep breath in, go to one side and try to stay on that side. Eyes closed, and you're breathing out longer than breathing in. You're practicing with me, try to stay in this pose and do your breathing. Breathing out longer than breathing in. Slowly come back in the middle. Again, breathe out first. Take a deep breath in. Go all the way to the other side. Then come back in the middle. 3 asanas for your proper elimination. We did one sitting down, Shankhasana, or your Jathar Parivartanasana, Utthita Tadasana, Tirjak Tadasana, and Kati Chakrasana. Kati is the west rotation pose. Separate your feet. You can do two ways. You can put your, take your left hand to the back, right hand over your left shoulder. Breathe out first. Take a deep breath in, and slowly go all the way to the back without turning your shoulder. And slowly come back in the middle. Same thing again, right hand goes to the back, left hand is over right shoulder. Breathe out first, take a deep breath in, go all the way to the back without turning your shoulder. Always remember, always you're breathing out longer than breathing in. You can do it with the hands in the front. Put your hands in the front. Breathe out first. Take a deep breath in. And slowly move your body all the way to the back. And same breathing out, you come back in the middle. Have your eyes closed so you can pay attention to your breath. Again, breathe out first. Take a deep breath in, all the way to the back. Kati Chakra Asana, west rotation pose. Another very powerful asana is the balancing pose. It's very, very important. When you do the balancing pose, this is called your sign of health. Our balance comes from a hand. Like when you fall down, generally fall down on my hand. So instead of my hand, I take my hands, let's see, I put the hand as a prayer pose. Paschim Namaskar to the back. Like if you can see me, I'm doing a Paschim Namaskar to my back. And my feet are together. Then I'm going to activate my other side of the brain. I'm right-handed, right-footed. See if I can stand on my left foot. If I can stand on the left foot, 10 seconds. Almost feels like 10 years. 20 seconds, 40 seconds, 60 seconds. Then you do close your eyes. If you can stay standing, closing your eyes, that is a perfect sign of health. If you can do that, there is enough evidence today that improves your survival. It is almost as good as a cardiac stress test. Closing your eyes. Again, stand on the right side. Initially stand for a little while and then close your eyes. It's a powerful tool. Standing on one foot with our eyes closed, you can look at all the literature. There's a lot of literature published. There's a cardiologist in Brazil has studied 3,000 patients. Another the healthy, and especially when yogi will be doing it more and more, called inversion poses. Inversion poses are very important. What happens when you put your head down, your pressure inside the head goes high up, pressure inside the eyes goes high up, pressure inside the neck goes high up, and you cannot talk, you cannot breathe, you are miserable. But if you can keep your head down with a normal effortless breathing, slowly and slowly your homeostasis comes in play. Your baroreceptor sensitivity goes high up. So your intracranial pressure starts to come down. Intraocular pressure starts to come down. Intracarotid pressure is going to coming down. It almost acts like a beta blocker. It's a very powerful tool, baroreceptor activation. When you do a pranayama, it also does what it does. It's called chemoreceptor sensitivity goes down. So this is a powerful asana. This is called prasharito, means wide. Padahastasana, the hand touching your feet. Prasarita Padahastasana is so relaxing that you will be able to do a Kapal Bhati Pranayama. Remember, Kapal Bhati Pranayama is all relaxing, pushing your belly button to the back, and you will hit the diaphragm and the lung, and air will come out. See, if you are doing with me, keep spreading your leg. See how far you can spread. Generally, for our practice, we will be able to spread the width of the mat. When you do the width of the mat, slowly put your hand and start coming down. Follow your breath, no pain, have an effortless breathing. And what you do, for us, we come all the way to the ground. My head is on the ground and I'm so relaxed, so comfortable, I can do a Kapal Bhati Pranayama. Can do continue for a long, long time. It in fact massages my pelvic floor. Wonderful practice for women with the pelvic floor dysfunction, men with the benign prostatic hypertrophy. And we have done all the studies which shows that it really improves your prostatic function. So, 5 asanas for proper elimination. I have all of them in my book. You know, many of you have my book, Yoga Therapy, Ayurveda, and Western Medicine. Let's do one asana laying down, which is called a part of your Shankha Praksalan, called proper elimination. It is called Tirjak Bhujangasana. You can do all the asanas in the back, but generally you do in this also in the steps. Like when you go down for doing the asana in the prone position, you sit down in a Vajrasana. From Vajrasana, you slowly go down, you know, in the 4th foot, almost like a Marjarasana, and then don't get in and out of a pose, you know, take your time and going down. When you go down, the head down, it's a wonderful relaxation practice. In yoga, the relaxation practice are called the most powerful asanas. You know, this is called Shakti asana. Put your hand almost like a Markatasana. Turn your head on one side, slowly take the one leg, 90 degree your hips, 90 degree your knee. It's like your Savasana. In the yoga therapy, you don't need a Savasana because every asana you do is a Savasana. You're relaxing, you're so comfortable, you do the opposite side. Slowly and slowly turn your head on the other side. The way you put your feet, 90 degree angle in your hip, 90 degree on your knees. Slowly you do the asana. You all done here. You have all done a Bhujangasana, Locust, Shalabhasana, and we'll do another time the asanas for your back pain, which is called a back bend on the mat. So normally you do the Bhujangasana, putting your feet together, but in this Bhujangasana you separate your feet until the width of your mat. Then you slowly get up into a Bhujangasana, and when you can get up into the Bhujangasana, then slowly turn your head over the left shoulder, trying to look into your right foot. Tirjak Bhujanga Asana. Come down again and do the opposite side. And when you get up, slowly get up in a Bhujangasana. Normally you can go all the way high up in Bhujangasana. Look over your right shoulder towards your left knee. This is the 5th asana for your Shankha Praksalan. Let's do a couple of asanas which will be doing it for your on the head down for your igniting your Agni. JATHAR Agni, if you want to ignite your JATHAR Agni. So again, you lay down. Again, when you're laying down, always do one thing, be comfortable. Like here is sometimes if your chin is high up, chin is above your forehead, it is very sympathetic. Try to get into the chin below your forehead if possible. If not, you can use a small pillow. Put this pillow under it, and again It's relaxation. When you're ready, you can separate your feet, hands on both sides. We'll also show you how to fall asleep in this posture. Very, very important. Feet will go high up, feet will come down. Asanas, which are concentrating here. That's the site of your Agni, JATHAR Agni, digestive fire. So what you do, put your feet together. This is called your Utthita Padasana. That means raising your feet, not all the way high up, just all the way up to about your 30 degree. So the 30 degree, then take the hands high up. So if you get into a Naukasana, a boat pose. Very powerful asana, a boat pose. When you do a boat pose, you'll see all the concentration is here. Utthita Padasana, Naukasana, Pavan Muktasana. You hold your feet together. Sometimes you can take your hand, clasp your hand and bring it close, raise your head high up, touch your nose to the knee, then slowly your chin comes in front of your knee, relax enough, you can roll even side to side, one side, other side. It's a very nice way. You can do also front and back, go all the way to the back and the front. It's a nice practice. You feel so relaxed, feel so comfortable that you don't need any savasana. Whole yoga therapy is your savasana. I hear a lot of noise from outside. Let me just close the door to get out of this noise. It's just distracting me. I hope we could reduce the noise for all of you to hear. Okay, so coming back, we're doing the laying down asanas. We'll be doing asanas also to go to sleep, laying down. So what we did the Utthita Padasana, feet raising. Then we did a Naukasana. We did your Pavan Muktasana. Next is your Jathar Parivartanasana, or your Makarasana. You bend your both the knees, and all of you have done very well. Let's do a little bit more, just a little advanced way. And if you're sitting in a chair, you'll be able to do it too. In a chair, you sit down, put your hands on both sides. Now, this is a little bit advanced. You raise both the feet high up. Then look onto your left hand and bring both the feet and touch into your right hand. Same asana which we have done before so many times, just bending there at the level of the hips and the knees. It is raising both the feet high up. Slowly you come back high up again and to the opposite side. You're looking into the right side, and both the hand goes all the way down, both the feet touches your left hand and your right, and you look at the right side. A lot of interesting name, Jathar Parivartanasana. That means your stomach is rotating both sides, stomach rotation asanas. Markanasana, like a monkey. Monkey does like this. Also Merudanda Sanchalanasana, this is a moving your spine. Setubandhasana is also, remember these are all asanas, you are focusing on your belly button. Bend your knees, separate up to the width body. So if you can touch your hand, feet touching, back of your heel, and slowly raise your body high up. And once you raise high up, you can clasp your hand, put it high up, and it just keeps going high up and higher up. Best way to do it when you get into the balancing pose sitting here. So if you can raise one foot and stay in the one-footed Setuban Sarvangasana. Bring your feet down, bring your other foot high up, and bring it down. And slowly come down. When you relax in this posture, you are able to do it. Very nice asanas, like your shoulder stand, Sarvangasana. We'll do a Padmasana, Sarvangasana, the Halasana. We'll do it next week. When you do for the yogis, you will see how the yogis can do. Okay? We'll do a set of pranayama, a little focus guided meditation. Before that, let me show you how we fall asleep, how the yogis sleep. Okay? So, when you hit the bed first, remember, you sit like a baby. How do you sleep like a baby? You take your both the feet. Take a look at me. I put both the feet together and drop it here, and slowly drop your knees down. You'll be able to see your knees are going to go down very easily. Hasta Mudra, which is very relaxing mudra, is Adhi Mudra or Balabushka Mudra. Because why? We're sleeping like a baby. Put the thumb inside, close, and put it on your body side. This is the beginning of your sleep. That's the way you start sleeping. Now incorporate, say in the stages you're going to go to sleep. It's yogic sleep. Now you bring your abdominal breathing, the way the baby is breathing. If you're new to it, put your hand here. When you breathe in, the stomach wall will rise high up. Breathe out, stomach will come down. So if you're sitting in a chair, you'll be able to do it. Sitting in a chair, you breathe in. When you breathe in, let the stomach wall come out, and the stomach will go in. So sitting in a chair, you adapt all these asanas sitting in a chair. Then what we do here now, you incorporate two things. One, you do a breath holding, and then you do a longer exhalation. What the breath holding does is called a CO2 narcosis. When you breath hold, your body builds up your carbon dioxide, and the carbon dioxide acts as a narcotic. So what I will do, I will breathe in the count of 5 in. I will hold about 4 times. I will hold about count of 20, count, hold, then breathe out with a count of 10. 1:4:2. Before that also, I try to do a long exhalation, then inhalation. For my practice, I'll do about 10 times breathing out longer than breathing in, about 10 times breath holding. By the time, it doesn't take much time, 2 minutes, 3 minutes, and really fall asleep, become very sleepy. So let me show you first what is breathing, just show you only one time, so you will know the technique. So breathe out first. So take a deep breath in, like a count of 5 in. And breathe out with a count of 10 out. Continue it for about 5 to 10 counts when you're going to sleep. Then you bring the breath holding. We do the same technique also during your alternate nostril breathing. It's called a Nadi Shuddhi Pranayama. So breathe out first, breathe in with a count of 5 in. Hold your breath for count of 20. Breathe out with a count of 10 out. You're practicing with me, you practice it little longer and longer, about maybe 5 times, 8 times, 10 times, and it may not happen on the first day, but it will happen. You will fall asleep very easily. Next we do, at the beginning of your sleep, you sleep on your right side like this. So yogis sleep with it's called a fetal position. They will bend the knees like this, then take the hand, and I've been doing it for a long time. It is a powerful tool to fall asleep. You don't need a pillow, you don't need anything, because yogis don't have any pillow. In fact, when I put a little pillow under my head, I just take my hand like this, like you can get a little pillow and show it to you how to even sleep with a pillow. So if you get a little pillow, this is the yogic way of sleeping. So you're putting your head down, hand is on this side. In a sleep, what happens in a sleep, your body core temperature goes down and you get a profound level of relaxation. Initially, our body core temperature is high up. So if you sleep on the right side, your left nostril opens up. Remember one thing I'll show you during pranayama, that always we have one nostril is more open than the other side. The left nostril breathing is called your Chandranari, cooling energy, and it's a balance. Body has a high core temperature, bringing the cooling, and body is going to fall asleep. After a while, when you're almost sleepy, you turn on your left side and sleep on your left side. You sleep in the same way. Okay, let me just change my face so you will be able to see it better, what I'm talking about. So the final sleep will be on the left side. How you're going to sleep? This is the way I sleep. I also sleep, this is a yogic sleep. So you're putting your pillow, when you're using a pillow, sorry. Here is your pillow, a hand is here, eyes are closed. Now what happens when you are sleeping, your body core temperature is going down, and your right nostril is open. When your right nostril is open, you are putting a little heat coming in. This is Surya Nadi, sun energy. So you're balancing. Remember, the whole yoga practice is bring a balance. Health is defined as a balance of your body, mind and spirit. Here I am. In a short time you fall asleep. In a short time you go to stage 3 and stage 4 sleep. When you get up, what you do, straighten up your right foot, wait a little bit, then just gently with your hand you get up and do not get out of the bed. Very important. Yogis will take a little time. Just sit down comfortably, let the whole body get balanced. I generally do, I just hang my foot down and I sit down for a while and then slowly get up, stand up. The first I sit down in a squatting pose, I drink a glass of water from a copper vessel. You initiate your proper elimination. And always happens. It's happening for me, years and years and years. Okay, let's do a little bit of a pranayama practice. Remember, pranayama is a medication. Pranayama practice should be must. And the pranayama is in a set of pranayama we do. And always you can do a very nice sitting the pranayama in the chair. When you do pranayama, keep your spine straight. We call Merudanda Achal, spine straight. And then it's called a mind quiets down, called Manasthir. Manasthir, and your many a time I can show it to you if you can do, like I have a little wall, you can see on the side. What you can do, you can sit down like in a Baddha Konasana. Now if you can see me, it may be a distance for you to see, but if you can see me, I can sit down here. I can take my foot, I can bring it, I can go all the way to the back. I put my foot on the top, and both of my knees will go down, and my spine gets straight. I'm, totally in a proper relaxed state, and I do the pranayama with this because my back is supported. What happens here is that when you're doing a pranayama practice, that you get some relaxation of the muscles of your back, and when you get the relaxation of the muscles of your back, you feel a little bit of a uncomfortable, and that's what you want to. So it's a nice grounding asana. Vajrasana, the thunderbolt, is a very good asana for your pranayama practice. So here I'm sitting down Sukhasana, both the feet under my knees. I'm very comfortable. Remember the first pranayama, which we have all been doing during the whole practice, was a exhalation longer than inhalation. A friend of mine, Linda, she wanted to know all the Sanskrit name of the breathing practices. So let me share with you also, so it will for a record. Inhalation is called Puroka. Exhalation is called Rechuka. Breath holding is called Kumbhaka. Long is called Dirgha. So long inhalation is Dirgha Puroka. Long exhalation is called Dirgha Rechuka. And then breath holding in inhalation, when you take a deep breath in and hold, that's called retention. That is your Abhantarin Kumbhak. Breath holding in exhalation after a breath, it is called your suspension in English, suspension. That is called a Bajja Kumbhak. So let's start practice what the healthy or Nirogi will do. Nirogi first will do a very powerful relaxing pranayama. Powerful relaxing pranayama is called a Murcha Pranayama. And you do it before even to go to bed to sleep. You do Murcha Pranayama, you go to sleep. This is a Jalandhar Bandha, chin lock with your breath holding in inhalation. The concept is a breath holding in inhalation, the lung starts to expand a little bit. When you expand, the herring brewer reflex sets in. When herring brewer reflex sets in, a vagal nerve activation thirst. It doesn't let your lung expand anymore. A parasympathetic activation start, and doing a chin lock, you massage your carotid sinuses. Again, hand mudras, very powerful relaxing mudra is your Adhi Mudra. Put your Adhi Mudra both your knees. And breathe out first. Take a deep breath in. Hold your breath. Slowly drop your chin down. Let the chin comes down towards your chest without bending your neck. And you stay in the posture, keep counting how long it can be. 1 and the 2 and the 3 and the It's a wonderful practice. You do it few times, you definitely will fall asleep. Basilica Pranayama, bellows, and I will show it to you when you do the practice for yogis. We'll do the Basilica Pranayama with Asana practice. We'll do your Dan Baitak. We'll do push-ups and sit-ups. So Basilica is like a bellows, like inhalation, active exhalation. Huh? Generally, you do with a hand raising high up. What it does, it also affects your frozen shoulder. You do it very slowly. When you bring it down with like a Adhi Mudra in a sequence called a Ishwar. Ishwar. The next one you do a called a So Hum. Very rapid, called a Vishnu. We do generally a set of 20 slow, 20 medium, 20 fast, one cycle. Generally do 2, 4, 6, 8 cycles. So let's do only one cycle, and you do with me. If you have any problem, you stop and keep doing breathing out longer than breathing in. Bellows. It's the beginning of your pranayama. With your eyes closed, hands high up, in a slow, 20 slow Basilica Pranayama. 20 medium. So hum. Ten fast in a Vishnu. One cycle of Basilica Pranayama. Wonderful practice. You get a hyperventilation syndrome. You get an altered level of consciousness because it creates a cerebral vasoconstriction. Blood vessels to the brain starts to close down. You get a circummoral numbness, carpopedal spasm. These are all due to the low calcium, ionic calcium in the blood because of hyperventilation. And it removes. So now what happens now? You take a deep breath in. This is called your Dirghashas, 3-stage breathing. When you do the breathe, you breathe out, fill up the lower part of the lung, middle part of the lung, upper part of the lung. Normally, you do only fill up the lower part of the lung. Next time when you do for yogis, you will see we'll be doing a lot faster Basilica Pranayama. Basilica is a bellows. This is the bellows you use for your fireplace. For the blacksmiths, they use it. Very interesting way. The bellows. Like just to give you one example, we'll be doing a little longer. We'll be doing very faster. We continue 200, 400, 500, but completely effortless. Why? We'll be practicing every single day. Next pranayama for healthy, Kapal Bhati Pranayama. Kapal is a forehead, Bhati is a shining. Your forehead shining pranayama. Kapal Bhati pranayama. So there is a balloon here, the diaphragm here, balloon here. You push your belly button to the back and air will come out. Nothing happens, nothing moves, only this one. Pranayam. Prana is your life force, is a subtle energy, keeps us awake, alert and alive. Yam is a control and restraint. Your breath is a carrier of your prana. Prana is like an electricity. But also Hasta Mudra, hand mudras are also called neurophysical connector to have the prana going to the organ of healing. We'll do a little meditation, then you will see pranic healing. So we do it a Hasta Mudra. This is your Hana Mudra, Gana Mudra. Put your index finger down, Vayu Mudra. This is a Shunna Mudra. This is your Prithvi Mudra. This is a Varun Mudra. This is your Shakti Mudra, Prana Mudra. It's Apna Mudra, Apna Vayu Mudra. It is a Linga Mudra. You do the Linga Mudra. This is your Ganesh Mudra. Lot of hand mudras. This is a Hakini Mudra. This is the Shankha Mudra. So we generally do either 5 or 10 mudras and do the Kapalbhati pranayama very effortlessly. Let's keep doing about maybe 10 counts each. In my practice, I will do about 50 in each mudras, and primarily when you do only up to the level of your effort. You have any effort, you stop it. And effortless, your start wherever you are, your goal will be between 5 to 10 minutes of Kapalbhati pranayama. It is called Agni Pradhan pranayama. It ignites your JATHAR Agni. So let's do it and I'll tell you the benefit of this pranayama. So touch your index finger and thumb, put it over your knees, close your eyes, bring your awareness in a belly button and push it very slow, 1 per second. For yoga teachers, very important, when you do Kapalbhati pranayama slowly, it is your pranayama. When you do it very rapidly, it's your kriya, Shat kriya. What are the Shat kriyas? Tratak, Neti, Dhauti, Kapalbhati, Nauli, Basti. So let's start. Change your mudra to Vayu Mudra. It's control your vata and also it quiets down your pain. You keep on doing it, I'll tell you the benefit of this. It massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your small intestine, massages your colon. For female, it massages your female reproductive organs, massages your uterus, massages your tubes, massages your ovaries. Change your hand, the Shunna Mudra. It improves your hearing. For men, it massages your prostate, massages all the intra-abdominal organs. It also massages your diaphragm, massages your lung, so all the air comes out from your lung. So you put your hand, you'll see air comes out. Change your mudra to a Varun Mudra, touch your little finger and thumb. I'm just showing you how to do it. Generally do it first thing in the morning when you are all the after rituals. This is getting a little later part of the day. So I'm showing the technique, not the whole practice. In between the lung there's a heart. It also massaging the heart. In yoga, when you massage your organ, the organ functions better. So when you gently massage your heart, it's very good for people with heart disease. I call it called internal CPR, cardiopulmonary resuscitation. When the heart stops, you keep on pressing from outside, called a chest compression. Touch a little finger, ring finger and thumb. This is your Shakti Mudra, Prana Mudra. Wake up in the morning, you don't have enough energy, you do in a Shakti Mudra. So when you touch your like the ring finger and thumb, this is called the Prithvi Mudra. The grounding diseases like diabetes, obesity, especially truncal obesity, called it bhuri, truncal obesity, very important. You do the Prithvi Mudra and Kapal Bhati Pranayama. Man with a prostate problem, benign prostatic hypertrophy, you do a Varun Mudra with Kapal Bhati Pranayama. People with a high level of any blood, this is called a Pachun Mudra. This is your Apana Mudra, like elimination, ring finger, middle finger and thumb. High blood sugar, high cholesterol, there's a lot of things. Like high cholesterol, you do call it Surya Mudra and the Kapal Bhati Pranayama. Kapal Bhati Pranayama with a mudra, it gives you a double effect. When you bring your index finger down, this is called a Hridaya Mudra. It improves your cardiopulmonary function. You can do like a Linga Mudra and do a Linga Mudra and do a Kapal Bhati Pranayama. It's good for your flames, good for upper part of the body. So you did a Murcha Pranayama, you did a Basilica Pranayama, the Kapal Bhati Pranayama. Next one is your Anulom Vilom Pranayama, alternate nostril breathing. And we'll do a little bit with a called a Nadi Shuddhi Pranayama with your breath holding. Again, as I said, it's getting into the later part of the day. I'm just going to show you the technique. And in the morning, you do it. You do it until you have any effort in doing it. And then breathe about 5 to 10 minutes. 25 minutes of asanas, 25 minutes of pranayamas, 10 minutes of meditation. Left hand, do a Hana Mudra or Jnana Mudra. It's a very quieting down mudra. Right hand, close your right nostril. Very gently, don't push all the way down to close it. Just put it underneath your nostril. Breathe out through your left nostril. Breathe in through your left nostril. Drop your hand down, close your left nostril with the ring finger and little finger. Breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. Then you bring the concentration. Now do a Vishnu Mudra, take your index finger and the middle finger, put it in between eyebrows and third eye, close your eyes, bring your attention in the third eye. Then the balance, take the left hand, hold on to your right earlobe. The very powerful balance. When you cross your hand, hold the earlobes, especially when you do sit-ups up and down, it's called a super brain yoga. You can always do it in the balancing using the opposite hand too. The opposite hand and do this way. So balancing. So let's do on the one side today. So now your concentration is in the third eye and you are doing the alternate nostril breathing. Breathe in through your left nostril, breathe out through the left nostril first. Breathe in through your left nostril. Close your left nostril, breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. This is the technique. You keep on doing it. Within a short time, you will have no idea where you are. You will have no idea what you are doing. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is cooling. So left nostril breathing is called your Ida Nari, Chandra Nari, moon energy, cooling energy. Right nostril is controlled by the left brain. Left brain is analytical, left brain is heating. Left brain is male, so right nostril breathing is called a Pingala Nari or a Surya Nari, sun energy. It activates both sides of our brain. It brings a balance back. It balances all the body type, Vata, Pitta and Kapha. It balances right side and left side of the body, and it brings a focus. It's a powerful tool for memory. When the memory goes away these days because we lose our focus. We used to remember the name of all my friends, their telephone number. Now all of them in my mobile phone, my focus is gone, I cannot remember. This is alternate nostril breathing with a balance. Then is it extend a little bit more, it's called a Nadi Shuddhi Pranayama. It's called a channel cleansing. What you do, you incorporate a breath holding. Same ratio, 1:4:2. So you will do a count of 4 in, count of 16 hold, count of 8 out. I'll show you one cycle, then you will do it. And then finally when you do meditative pranayama, we'll do a focus, we'll bring our attention to your breath, and we'll do alternate nostril breathing without closing our nostril. That's called meditative alternate nostril breathing. So now you use your hand in the Vista Mudra, drop your index finger and middle finger down and make a pinch with a little finger, ring finger and thumb. So left hand to another mudra, this is a Hana Mudra or a Magana Mudra. Put it over your nostril, close your right nostril, breathe out through your left nostril, breathe in through the left nostril with a count of 4 in. Hold your breath by closing both sides for a count of 16. Close your left nostril, breathe out through right nostril with a count of 8 out. Breathe in through the right nostril with a count of 4 in. Hold your breath for a count of 16. Breathe out through the left nostril with a count of 8 out. Now, Nadi Shuddhi Pranayama, 1:4:2. You do it more and more. When you can do it, do a count of 5 in, count of 20 hold, count of 10 out, count of 6 in, what your body will allow without any effort in the breathing. Very important practice. Next pranayama you do, we call it a quieting down all of our 5 senses with the vibration called a Bhramri Pranayama. Bhramri Pranayama will do because Bhramri is a very meditative pranayama. Remember the whole yoga practice, the 8 limbs of yoga, Yam, Niyam, Asana, Pranayam, Pratyahar, Dhyan, Dharan, Samadhi, all going to the same outcome is a meditation. Ahimsa, non-violence, is a meditation. Satta, telling truth, is a meditation. What meditation? Staying calm in the middle of crisis. If I tell a lie, I have to remember, my chitta vritti doesn't take place. My chitta vritti always there. Chitta vritti nirod. If I tell a truth, I don't have to remember. I don't have to remember the truth. Very important. So you do a resistive inhalation, then you have a resistive exhalation. Resistive exhalation is called a Shankha Pranayam. We can do a very blow. You can do a clasp your hand, blow it there, or you can do a Shankha Mudra and blow it in the Shankha, like take a deep breath in, you blow in a Shankha. So we'll do that. We'll do it more and more, and you will see. Let's first do a little Ujjayi Pranayam, a little Sitali Pranayam, and Sitkari Pranayam. Ujjayi Pranayam is try to close your throat, try to breathe in, and then you'll see when you're so relaxed, you will have even a bandha, like Uddiyani Bandh. Your abdominal wall will go in. Like when you do Uddiyani Bandh, you breathe out first, Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Then slowly drop your chin down. Uddiyana Bandha increases your negative intra-abdominal pressure. It causes proper perfusion of the organs. And to ignite your Agni, you can do also Agni Sarkriya. You do a Uddiyana Bandha, then move your abdominal wall back and forth. You're very relaxed with a Adhi Mudra. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and move. Wonderful practice. Beautiful practice for diabetic people. The Mula Bandha is the same thing. Contract your pelvic floor with your renal sphincter and pull it up. In a Ujjayi Pranayama, we do it very relaxed way. Try to close your larynx and try to breathe in. So you got a little cough. When you get a cough, it's entirely normal. That means you are hitting the right place. Cough comes from where the Ujjayi Pranayama is going to have a proper relaxation and tightness. Very good for your snoring, for your sleep apnea, because it activates your vagus nerve, superior and inferior laryngeal nerve. Signal goes to your brain like a brain stem. Other signal comes out through glossopharyngeal nerve. Glossopharyngeal nerve supplies your soft palate. Palatopharyngeus, palatoglossus tightens up. It's like the surgery the ENT people do, UVPP, uvulopalato-pharyngoplasty. Or it pushes the, like a hypoglossal nerve pushes the tongue in the front. It's a powerful tool for your sleep apnea. Then it's so relaxing, you incorporate your Jalandhar Bandha. Jalandhar Bandha is the clip. Then you breathe out through your left nostril, which is also cooling, which is your Chandra Nadi. So again, just put a Adhi Mudra. And you know the Adhi Mudra is so powerful. If you keep on doing it, your brain gets a signal called neuroplasticity, and you will be doing the whole asana practice with your Adhi Mudra. So breathe out first. Take a deep breath in. Completely breathe out. Wonderful relaxation practice, activation of parasympathetic tone. Little bit more advanced pranayama. I can show it to you for the yoga teachers who will understand. So when I'm doing the Ujjayi Pranayama, you'll see my whole abdominal wall will go in, okay, your Uddiyana Bandha. Because bandhas are also very relaxing. This is called your Kundalini Jagaran, your chakras, ascending of your Muladhara chakra to your Sahasra chakra. So we show it to you. So what happens to your abdominal wall? Here it is. Ujjayi Pranayama with your Udyani Bandh. You always breathe through your nostril, nose. Do not breathe through your mouth. Because when you breathe through your nose, the nose is like your filter. It filters all the air. It's like a personal air conditioner. Outside air is warm, it's going to cool it down. Outside air is cool, it's going to warm it up. And when the air goes through over the mucosa of your sinuses, it releases a substance called your nitric oxide. Nitric oxide is a powerful vasodilator. It opens up the blood vessels. Nitric oxide then acts on your endothelial lining, called endothelial relaxation. We know from our Western medicine, our health is defined as endothelial health. Endothelium releases cyclic GMP, acetylcholine, which are activator of your parasympathetic tone. As a physician, you know the epinephrine, norepinephrine are the mediator of your sympathetic tone. So then it goes through the cycle turbinate, and then all the air goes into the larynx. But if you breathe through your mouth, you don't know where the air has gone in. It's gone through your esophagus to your stomach, maybe partly in the larynx. But if you have to breathe through your mouth, you can breathe in through your nostril, breathe out through your mouth. Breathe in through your nostril, breathe out through your mouth. But also remember one thing, we have the muscles of inhalation, muscles of exhalation. So when you breathe out through your mouth, the muscles of exhalation stops working. So this is Fetal Pranayama. This is not to get the air in, it's a cooling down. Roll your tongue out, breathe in through your old tongue. Close your mouth, breathe out through your nostril. Within a short time, your whole inside cools down. Very good for people with pitta disorder, women with hot flushes, people with gastroesophageal reflux disease. If you cannot stick your tongue out, you can breathe through your teeth, called Sitkari Pranayama. Lot of other pranayamas we have. We have a Savitri Pranayama, holding your breath. We have a Plavuni Pranayama. We have Om Pranayama, Pranabho Pranayama. Like Om has a three component, A, U, Ma. A, you do with your called Chin Mudra. U, do your Chinmayi Mudra, hands down. Ma, do your Adhi Mudra. Okay? We'll practice it next Saturday for during your practice for yogi, because there will be a little bit more advanced practice. Let's finish doing a pranayama leading to meditation. So, first pranayama will be your Brahmari Pranayama. Brahmari Pranayama, you shut down your five senses, remember, fifth limb, pratyahara. Pratyahara is the reject, ahara is the intake. What are the intake? We intake through our five senses. I see, I hear, I smell, I taste, and I touch. I cut down all the senses. Then I create a vibration. Brain has a vibration, two vibration cancels, quiets down, and you get into called a harmonic resonance. You get a profound level of calm and quietness called Chitta Vritti Nirodha. Few minutes, 5 to 10 minutes of meditation, you'll see it carries you throughout the whole day, because your body is ready. Body is in your Sthiram Sukhamasanam. Your breath is completely effortless. Again to the Hana Mudra. Keep your spine straight, eyes closed, and slowly bring your hand, put your index finger in the forehead, close your eyes with 3 fingers, close your ear with your thumb, close your mouth. We'll breathe out through your nostril, breathe in through the nostril, and breathe out with the sound of a bumblebee. Then we'll get into a focus guided meditation through alternate nostril breathing. Then you'll do your breath centered meditation. Then we'll get into your little silence. Just to do one, just for a practice, just to show you how to do it. practice, we'll do it a little longer. Breathe out first. Take a deep breath in. Touch your index finger and thumb, put it over your knees. Bring your awareness to your left nostril. Without closing the right nostril, breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see I'm breathing in through my left nostril. Breathe out through my right nostril. Breathe in through my right nostril. Breathe out through your left nostril. When you continue for a short time, you'll be in a total transcendental state. Then for a guided and a visual meditation, visualize your breath again at the tip of your nose. Outside your nostril lies the prana. Prana is like the electricity and a breath is like electric cable. Breath is going to pick up the prana. Prana is coming through the nostril, behind your throat, and prana is in my lung. It is first in the upper part of the lung, middle part of the lung, and lower part of the lung. In yogic tradition, my whole body does breathing. My lung is breathing, my liver is breathing, my kidneys are breathing, my skin is breathing, my whole body does the breathing. When my whole body does the breathing, then visualize the prana is going to the organ of healing. For me, organ of healing was my heart. So I'm visualizing prana is coming to my heart, doing the pranic healing. That is meditation, is medication. With back pain, visualize the prana is going through your back. With diabetes, you visualize prana is going to your pancreas. It's a wonderful pranic healing. I even change my posture because that gives me a balance. Let's go to the period of silence. Then we'll finish in a silence. All the five senses quiets down. Spine straight, eyes closed. We are in a silence. Slowly bring your hand in front of your heart mudra. Hana Mudra. Touch your little finger and thumb, separate your ring finger, middle finger and index finger. So Padma Mudra. Padma Mudra connects your body, mind and spirit. Heart is the site of the soul. Bring slowly the Padma Mudra towards your heart. We have a meditation called a heartfulness meditation. That is, the whole meditation is in the heart. Meditation is medication. Level of meditation, we became a disease-free. We became medication-free. We have a nice quality life. Wonderful daily practice. Slowly bring it in front of your heart chakra again, Anahata chakra. Bow your head down. This is the honor. I honor the divinity within you. Slowly finish with the pumping and cupping. Take your hands, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, this is a powerful activator of your vagal tone. You remove your glasses if you're wearing glasses. Take the hands, put it over your eyes like a cup. Let the eyes take all the heat from your hand. Then you massage your forehead, massage your eyes, massage your face. Very important, massage your ear, earlobe, back of your ear, front of your auricle, the tragus, even inside the ear, the external ear canal. This is called your auricular branch of the vagus nerve. You massage them. Slowly, your laryngeal plexus, pharyngeal plexus, you massage in the neck and the side. This is your carotid sinus massage. We do it when you have a supraventricular tachycardia. Massage in the back of your neck. It's a wonderful practice. Every single day. Takes about an hour of daily. 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Thank you for joining us today. So we'll have a series, we'll have a next one, will be a practice for yogi. You'll see, we'll do a sun salutation for yogis. Then we'll be doing, say, your Danbaitak, your sit-ups and push-ups we'll do, the different breathing technique. We'll do a little bit more, little advanced pranayamas, but we're also doing, remember, the quieting down, coming down are the advanced pranayamas. Okay, Om Pranayama, Pranavo Pranayama. Okay? So I see again a lot of comments and questions. I will be able to answer all of them. I'll go back and I'll answer for all of you. And thank you again for joining. See you again next Saturday, same time, 9:30 a.m. is your USA Eastern Time.